Vascular surgery can be risky and can even lead to stroke, but there is an advanced surgical procedure that's leading to a number of success stories. CBS 21's Chris Nallen explains in this week's Doc Talk.
The following segment is sponsored by Geisinger Holy Spirit.
More recently, in the last couple of years, there's been a newer technique where the advantages are twofold.
It's a procedure known as Transcarotid Artery Revascularization, or TCAR. John Calaitges is a vascular surgeon at Geisinger Holy Spirit.
You eliminate having to negotiate or navigate from the groin to the neck and all the possible problems that may develop from that.
That procedure, Dr. Calaitges notes as more difficult or even risky. TCAR, on the other hand, is the more advanced and localized procedure, bringing less risk during vascular surgery.
This procedure starts right at the base of the neck, so the access is very easy.
And reducing the risk of stroke.
This procedure allows the blood flow to be reversed to reduce the risk of stroke, and that you never have to cross the blockage.
Which means steering clear from knocking off pieces of plaque that could travel to the brain and cause a stroke.
It starts with the insertion of the catheter into the artery, and then you see the plaque, and then you see when the artery is clamped off, the blood flow reverses, and it goes through a little filter, and then it gets returned to the leg.
In many cases, surgeons like Calaitges can avoid using general anesthesia when performing the TCAR procedure.
We can do it under a local anesthetic, actually.
Posing less risk for some patients, especially heart patients.
Yeah, less stress to the body. General anesthesia produces a fair amount of cardiac stress, and oftentimes that's the most stressful part, risky part of a procedure.
TCAR not only offers less risk, but a rather quick recovery.
99% of people go home the next day, and the recovery is, within a couple weeks.
For this week's Doc Talk, I'm Chris Nallen.